Welcome to the webinar for Getting Our Lives Back, the Fibromyalgia online course. In this webinar, I will preview for you what I'm going to teach you in the online course, plus give you 2 pro tips, nuggets of information that I think could dramatically decrease your symptoms. Here is some of what I will teach you in the online course. What is fibromyalgia? Do we know what causes it? How is fibromyalgia properly diagnosed? And why the inaccurate tender point exam should not be used. Is fibromyalgia real? I will give you the links to many research study results that may surprise and amaze you. I will also give you my game changers to fibromyalgia recovery, including information about a revolutionary food plan that balances the blood sugar, allowing many people with fibromyalgia to have more energy, slightly less pain, slightly better mood, and less fibrofog. I will give you information on how to get consistent aerobic exercise without crashing, allowing you to have the benefits of getting in shape and feeling better. And I will teach you about a number of techniques to help balance the nervous system, which can decrease anxiety and improve sleep. And I will talk to you about the various fibromyalgia treatment options, including low-dose naltrexone. Plus, I will give you information about the groundbreaking guaifenesin protocol, which may get to the root cause of fibromyalgia, allowing us to treat, not mask, the symptoms. Pro tip number 1, your brain may not be getting enough oxygen at night. Almost half of people with fibromyalgia have obstructive sleep apnea, and most do not know it, because with fibromyalgia, you can have obstructive sleep apnea even if you don't snore or you're not overweight. That's right. In 2014, sleep specialist and neurologist Dr. Victor Rosenfeld did comprehensive overnight sleep studies on the general population and on people with fibromyalgia. He found that 21% of the general population have obstructive sleep apnea, and 45% of people with fibromyalgia had obstructive sleep apnea even without the risk factors of obesity or snoring. So, if you have fibromyalgia and you do not wake up feeling rested, you should have an overnight sleep study to check for obstructive sleep apnea. Because if you're not getting enough oxygen to your brain and your body at night, of course you're not going to feel your best. Talk to your doctor, ask them to order an overnight sleep study. And if you do have obstructive sleep apnea, the sleep specialist will talk to you about ways to treat it, so you will get enough oxygen to your brain and your body at night. Treating obstructive sleep apnea can help prevent heart attacks and strokes as well. Pro tip number 2, what your doctor may not know about how to accurately test your thyroid function. Your thyroid is a small butterfly-shaped gland that sits in front of your windpipe. It helps to regulate your metabolism. If you have fibromyalgia, you're at increased risk of developing low thyroid function or hypothyroidism over time. The problem with this is the symptoms of hypothyroidism, which can be mental fog, fatigue, body aches, and morning stiffness, can overlap with the symptoms of fibromyalgia, making it difficult to diagnose hypothyroidism by symptoms alone. So why don't you just get a blood test to determine if your thyroid function is low? Well, there are problems with this. Many doctors do not know how to properly evaluate the TSH, which is used to measure thyroid function, missing thousands of people with low thyroid every year. Why is this? Labs list the normal value of the TSH as up to 4.5, but most endocrinologists, thyroid specialists, believe that any TSH 3.0 or higher could indicate low thyroid function. There's change in the air. A group of thyroid specialists, endocrinologists, got together because they believe the TSH is not the most accurate measure of thyroid function. Instead, they are considering recommending that a T4 called a thyroxine be used instead. So, there are many causes of fatigue, but if you have fibromyalgia and you have severe fatigue and you've had it for a long time, you should talk to your doctor and ask them to order both a TSH and a T4. Do you want to learn more about fibromyalgia and ways that you can get your life back? I made the decision that this illness was not going to take over my life, and I was going to find ways to feel better. I did, and I teach these steps to my patients. And at least once a month, one of my patients thanks me for giving them their life back. If you have fibromyalgia and you want a more fulfilling life, then this online course is for you. Click the link to purchase and join me in Getting Our Lives Back, the Fibromyalgia online course.